Hello, good evening. We've met again for another interesting episode of your favorite Oral Health Corner. Today we'll be talking about treatment of dental caries. Remember the other time we spoke about dental caries and we said they are cavities that develop in the teeth as a result of the microorganism in our mouth converting sugary substance or sugary food into an acid, and this acid end up dissolving the hard tissue of the teeth and then causing the cavity. Today we'll be looking at the treatment. The treatment also depends on the extent of the cavity. One is the cavity in the enamel, is it in the dentine or is into the pulp? Now, if the cavity is in the enamel or the dentine, then what your dental care provider will do is to prepare the cavity, that is, remove all the debris, clean it nicely, and do a simple filling for you. And that simple filling is enough to prevent any progression or to prevent any further pain. Now, the issue here is when the whole thing gets into the pulp, then the treatment options are reduced to about two. One, either the tooth is taken off or a complex treatment of filling is done, what we call the root canal treatment or the RCT. Now, in this case, the RCT, the dental care provider has to now open into the tooth, go into the root, and then bring all the debris and then the infected pulp, the content, the blood vessels and the nerve that have been affected. The person will bring it out, clean it nicely, and then fill it with artificial pulp, as I will put it. Then that is enough to actually sway all the pains and then heal the teeth. But what happens is that with the RCT, with time, the tooth becomes brittle or it becomes weak and can easily break. And in that case, you have to protect it with crown, dental crown, so that that tooth can become as strong as possible. So you realize that if it's like we said, if it's in the enamel or the dentine, it's just simple filling. That filling could be permanent or temporary depending on the opinion of the provider. But if it's into the pulp, then the options become two. Either it is taken off for you to have your peace of mind, or RCT is done. And when the RCT is done, later it has to be crowned so that the tooth could be protected from breaking or chipping off, so that you have your peace of mind. Any of these things that you will do or the treatment that I've mentioned actually will save your tooth, and they are not also painful. They are not painful. Most of us fear that when we go, they will do this, they will do that. None of them is fearful or painful. Just visit the nearest dental clinic and then you have your freedom. Thank you so much for your rapt attention.